will introduce his team. I'm sure this workshop will be great and state of art as usual. It will be hands-on rather than just a theoretical part. Dr. Khalid, the mic is you and and it's yeah, good luck for all of you.
Okay. Thank you, Prof. We are very honored and glad to be here. And I have my team with me. And we have a few stations designed for you today. We have about 4 stations. We'll start off with the first station, which is the MetaNeb device for airway clearance protocols for patients with cystic fibrosis. This will be led by Dr. Amal Al Khalfan, who is a lecturer in our program. As we move from one station to the other, I'll introduce the other faculty. So I'll hand it over to Dr. Amal, who will give us a preview of the device.
Hello, good evening, everyone. It's my honor to be with you. My name is Amal Al Khalfan. I'm lecturer at Inaya Medical College, and welcome to our respiratory care family tonight here. I will discuss MetaNeb device with all of you tonight, which is one of the devices that we could provide 3 different therapies in one treatment cycle, which are lung expansion, secretion clearance, and aerosol therapy at one time. This device is safe for pediatric and adult, and we could use it for vented patient, for trach patient, patient with face mask, and mouthpiece as well. It has 3 different modes. First mode is continuous positive expiratory pressure, where we could provide it along with the aerosol therapy for lung expansion purpose. It will provide continuous positive expiratory pressure and increase the flow in the airway for during inhalation and exhalation, will prevent the atelectasis and will reverse the atelectasis at the lung. This flow will move beyond the secretion that is retained in the airway, and it will help in secretion mobilization and reduce air trapping. The flow at this mode will be mobilized by the clinicians, and we will go up and down with the flow until we see the medication getting aerosolized out of the mouthpiece. The second mode in this device, it's continuous high frequency oscillations mode. It's a combination between a medication, the aerosol medication, and continuous high frequency oscillation, where it will form a continuous pulse positive pressure while patient is taking their aerosol medication to help in losing up the secretions. During this mode, a pressure gradient will be formed in the lower airway, where the secretion is trapped in the airway, and it will create a secretion from the lower airway to the upper airway, where we could clear the secretion up, or patient could cough up this secretion. The frequency of the oscillation, it could be as high as 230 beats per minute, or as low as 170 170 beats per minute. We could change the frequency of this oscillation through this knob as high, as I said, as high 230 and as low as 170. Okay, this is the device. This is the on and off bottom. The third mode that I haven't discussed is only the aerosol therapy mode. During this mode, the patient or the other 2 modes will be off. So we will be only providing aerosol therapy through that mode. This is the on and off bottom. This is a manometer. This is the knob where we change the modes, and this is the knob to increase and manipulate the flow, and this is to change the frequency of the continuous high frequency oscillations mode. This is the mouthpiece, the handle, nebulizer, tubing, biofilters. Okay, we could administer or use this treatment for 10-minute sessions, and we could use it or prescribe it for patients 2 to 4 times a day. So we turn on the on and off buttons, and then we pick up the mood that we want to provide. We pour the medication into the nebulizer, and if we're using the mouthpiece, we will just give it to the patients where they can start taking their treatment. And again, it could be, take the mask off. It could be leased for 10 minutes. It will be 2.5 minutes of aerosol and 2.5 minutes of lung expansion. And again, 2.5 minutes of aerosol and another 2.5 minutes of lung expansion until the whole 10 minutes of cycle is completed. We could switch between the mood. This is the continuous high frequency oscillations mood. You could hear the oscillations is working. And this is high. We could increase the flow. We can see the chest here is moving. We could switch the mouthpiece to a face mask if patients are unable to tie their mouth around the mouthpiece. And as I said, we could use it with vented patients online and a trach patients as well. That's the highest. This is the highest, this is the lowest. It's a single-use circuit, yes. That's all what I have for you about Miraneb, and I will handle to my colleague, Carol. She will discuss the cough assist with you.
So good evening all. I'm here to talk about the mechanical insufflation and exsufflation device, which is also called as a cough assist or a cuffillator. Okay, so the main purpose or the main design of this device is to provide positive pressure during inhalation with a rapid change to a negative suction pressure, which can generate a cough flow to simulate a normal cough. Now, this device can be given through a large face mask, through an adapter, or through a mouthpiece. Now, to see the device operation, so let's start with the device overview. So you can see the front, the display screen. We can see the manual switch here, okay, with a positive and a negative symbol here. And just below the manual switch, you can see the switch on off button. Just below the display screen, you can see the rectangular buttons. Okay, so the left and the right buttons are meant to change the settings or the parameters, whereas the central buttons are meant to navigate the menus. Okay. Now, moving to the back panel, as you can see here, there are air exhaust, an air filter, a detachable battery, the AC inlet cord, and the DC port. You can see the remote control port, USB port, and the saturation port. Okay. Moving to the side, you can see the SD card slot here. And to the other side, you can see the breathing circuit port here. Now, along with the device, you get the circuit with a bacteria filter attached and a large face mask. Okay. So the bacteria filter, along with the circuit, will be connected to the X circuit port. And let's start the device, connect the power supply to the AC inlet, switch it on, and we can see the display screen Okay, so the inspiratory pressure, or the inhale pressure, you can see here is the positive pressure which is delivered during the inhalation phase, and the time or the inspiratory time is a amount of time or the duration in which the inspiratory pressure will be given. And next here we could see the minus 40 centimeters of water, which is the expiratory pressure, and as well as the expiratory time. Okay. Now to talk about the device, we have two menu axes. The first menu axis is as you can see here, is a full option where the user can change the parameters or the settings accordingly. Okay. Next, if you need to modify any settings, you just have to press on the right button here to modify the settings. And as you can see, just scroll down the navigation menus to change the settings. Now, once you have changed the settings, go to the OK button, press on the OK button, and then press on the Finish button. Okay. Next, moving to the ventilator settings, moving to the settings here, we have mainly two modes. One is the manual mode and second one is the auto mode. So the manual mode settings are just the positive inspiratory pressure and the negative pressure which is being kept. The time will be controlled by the user or the physician. So let us see the manual settings here. So you need to click on the settings option and you can see the highlighted button here. The preset is already selected as 3. Next, you can see the mode option. If you need to modify the mode option, you just have to press on the modify button here and navigate the option. So now we can see it has been selected as a manual mode, and once it is selected, you can press on the OK button here and then finish. Now the patient is on manual mode. Okay, so you can see the exhale pressure, expiratory pressure as well as the inspiratory pressure here, and the okay. So now I'll be showing how to connect the device on the patient. So first and foremost thing, make sure the device is placed on a firm surface. The patient should be in a sitting position. And then I'll be switching the manual control for the inspiratory time as well as for the expiratory time. Okay. Okay. Yeah. So next, moving to the auto mode, you just have to click on the settings here, modify, select the auto mode. Okay. Now here we could see the expiratory pressure, the expiratory time, the inspiratory pressure, and the inspiratory time. So in the auto mode, all the settings will be set on the machine. Okay. Now let us see how it is being used on the patient. Yes.
Now, when using these techniques, one have to be very careful, whether it's the meta-neb or the cuff assist. The patient needs to be educated before about the process, because they will be very scared when positive pressure is delivered to them. You have to really coach them before. You have to test it with them, see how they tolerate it and how they can work with it. For example, this device, they need to know that they're going to get a positive pressure followed by a negative pressure. The objective of the positive pressure is to inflate the lung, okay, allow the flow to circulate behind the secretions, and then the negative is to help the patient pull the secretions out and eventually cough them out.
Yes. Indication. Yeah. Okay. Now, this device is mainly used in patients who are unable to initiate a cough, or mainly seen in patients of neuromuscular diseases or spinal cord injuries, or patients with paralysis of respiratory muscles. Now, this can be mainly used for lung expansion as well as for the airway clearance. And the main indication is mainly for the airway clearance, where it can be used as a non-invasive technique as an alternative for a suctioning. Now, the main highlighted feature of this device is it can provide oscillations, as well as we have a setting of cuff track, where in auto mode, the patient will be enabled with a cuff track setting, where the device will be synchronized with the patient inspiratory effort. So as you can see here, moving to the settings here, let us take the cuff track option here. So now when you have to modify, select it on, okay, and press on the finish button. We can see as the therapy is started. Okay. Yeah. Okay. So when the cuff track option is enabled, the machine will deliver the positive pressure only when the inspiratory effort has been initiated from the patient. Okay. Yes. Okay. Yeah. Yes. Yeah. Okay. Now, the next highlighted feature of this device is to provide oscillations along with the positive pressure as well as during the exhalation phase. Now, to select for the oscillations, go to the settings. You can select the options for oscillations. Okay. So in this, we could see it has been enabled for the both, which means during inhalation as well as during exhalation, the oscillations will be provided. So once we start the therapy, we could see that yes. Yes.
So we're going to move to the next station. The next station, we have a couple of devices. The mic, so you can hear him nicely.
لا السلام عليكم. مساكم الله بالخير. First, we'd like to thank you to give us the chance to be part or to give you a hint about the devices that it can be used to move move out the secretion. As you know, before we had we do have multiple devices to use to move out the secretion. All right. Before we do have the percussor, right, which is basically manual. Okay, then with the advanced technique, all right, where when the science become advanced, we start to they start to use the automated devices, right? Then they start to use vibrator, right, to move out the secretion. Okay, then later they invent one of the devices, which is the vest, right, which is basically use the pressure to vibrate the chest to move out the secretion. Okay, lately, right, we have contacted one of the company which is new in the market. They are using a new device. It's not used here in our country in Saudi Arabia. Basically, this device it's used the sound wave to vibrate the chest to move out the secretion. This device, there is no need to use to apply pressure on the patient. There is no need to, it's not complicated even device. It's user friendly, and we just have one demo here. It's like in our, today inshallah we'll display it in our workshop. Basically this device, we call it frequencer, or the name of it, it's frequencer. Basically, it's a device used, as I mentioned, a sound wave from the back of the device. As you can see, we only just connect the electrical plug. Then we just press that. We can just here press this button to switch on the device. Okay. So this is the plug. This is how can we plug it in. Here we can just plug the transducer, which is between the machine and the sound wave, or the transducer to them, which is generates the sound wave to the chest. Okay. طيب. When we turn it on, right, the first, the main screen, which it showed for us, it is like three. Yeah, just I'll make it clearer for you. We have here menu, which you can set the hertz, all right? We can set the hertz, we can set the language, and we can see what is the generation of the patients, and we can lock the screen from the menu button, right? Then from here, which is the start button, all right? I'm just trying to use, to make it clearer for you. So here, from here, the start button. Here we do have two variables, right? Which is it can be set. It depends on the patient age and the patient comfort, which is the frequency, which is the frequency of the sound wave. طبعا basically initially they are recommending to start with the 40 hertz, which is represent the wave that according to the study, it's like the wave when the tissue start to move. All right, and the intensity, which is represented as a percent, we can just set it according to the patient generation, like baby, child, and adults. All right, this is basically the display. All right, allow me to show you the parts which is it can be directly connected to the transducer. Depends on the patient. Age. We do have four sizes. One for the pediatric, two for adults. These two, it's for these two, size 3 and size 4. You can see the size it's written on the on the back of the this part. You can see it's size 3, and this is size 4, which is mainly for the adults. Okay, this is size 2. We are using it for the pediatric, and we do have one more part. It is for the neonate. All right. So basically, all right, for the neonate, we are going to connect this part to the transducer. All right. Then the vibration will be delivered by this hose, because the babies, they cannot tolerate the high frequency and high vibration. For this one, this part, all right, this item, we can use it only with the small child and the babies, which is, I'm talking about the neonate patients. Okay. So, and I'll show you when I set it for the adult generation. You can see basically we can just move this one to the adult. We can set it according the intensity. All right. We can set the intensity, which is the right variable. We can just set it according to the patient comfort. All right. And the frequency, we can just start with 40, and we can assess whether our frequency, if it's is it like suitable for our patient or not. We can decide in two variables. Number one, which is we have to feel the vibration at the patient back. All right, which is this is the first assessment, to see whether our frequency is it suitable for this patient. Number two, which is when the patient is, the voice starts shaking. All right, when the patient starts to talk, for example, or the patient start to generate some voice, we start to see or start to hear, the voice is shaking. And I'll show you, okay, and I will start the intensity with the adults 90% intensity, and I will start with the studies. There is some studies they are saying the tissue start to move or start to vibrate between 40 hertz, 42 hertz. So this is that's why the factor, they said the default setting when we turn the machine on, it is 40. Then we can change it according to the patient's condition, the intensity of secretion, and so on. All right, because once we increase the hertz, it means we are going to increase the vibration and so on. So I will start to use it. When we start doing the assessment, we have 6 spots, I would say. We can start by the lower lobes, all right? So we have 6 points, and the machine also reminding the practitioner for these points. You can see this picture of the lung. So it show the practitioner how they are going to find these spots. So basically, why they are starting from the bottom of the base of the lung, basically to move the secretion from the base and small airway to the middle airway, then to the large airway. Then the patient will, it's like facilitating clearing out the secretion. So basically, right, we just press start, and we can hear the vibration to start. So no need to apply pressure. We just attach the transducer to the patient, and the vibration will be start. Let's see. So we can see the voice is shaking. Those is as indicators that our heart, it is set correctly and appropriate for this, for an adult patient and for facer. All right. According to the patient, we can change the adapter, or the filter. So we can see this is adult patient. We can use 3 and 4 filter. If it's pediatric, we can use size 2. Neonate, we can use size 1. All right. And we have to, I have to focus on that. Thank you. It's like we have to make sure, we should not use the big filter for the babies because they cannot relate it. You can see the size of the body. We use the pipes or this hose too, right, to deliver the sound waves and to deliver the vibration. Now I finish for this device, which is the frequencer. I will move to the second device, which is the vest. All right. The difference between both of these 2 devices, they are similar. There is similarity between them. All right. ولكن the frequencer, it gives us a chance to use high frequencies. If we just assess the vest, the vest is not going to use the vest. We are not using sound waves. All right. So it's different mechanics. All right. Or there is different mechanism. All right, to deliver the vibration. So the maximum hertz for the vest, it's 20, all right? But like for the frequencer, we can reach up to 65. So you can see the intensity of the vibration. It's better in the frequencer, although it's new devices, all right? It's not, there is not, I would say, it's not common practice. It's new device, but it needs more investigation. Like it's apparently it's like it has more frequency and it can deliver more frequency. The other device again, which is the vest. All right, it's device. Again, it's user-friendly device. Basically, we just plug it to the electricity. It will turn on. Then we can just on the device, and from here, once it's like we can just press on. Okay, and we have to connect these two hoses, all right, to the device. Then these two and the inflated ball here just to control, and it can be given to the patient to control on and off the vibration or the treatment session. Okay, and we need the vest. Okay, طبعا the vest, we do have more than one size for the vest. Okay, we have pediatric vest, we do have adult vest, and it's not only vest, also we do have wraps. Okay, طبعا when shall we use the wrap, when shall we use the vest? It depends on the patient. Sometimes if the patient in the ICU, it means that we do have more lines, we do have more catheters. It's difficult to attach the vest to the patient. So we can use the wrap, the outcome, it is similar. All right, so now I will connect the vest to my colleague Hassan, okay, which will be my, inshallah, you will not be my patient, but it's like he's my colleague, okay? So basically, it's like we are going to put the stretch on on Hassan, okay? And we can connect the hoses to the vest, okay? Now it's ready for use, but let me remind you, or let me tell you what is the protocol. We do have two protocols, all right? One protocol, it means we are using low pressure. I'm talking about inflating pressure, but we are going to use, if we are using low pressure, it means we are going to use high frequency or more vibration. The other protocol, it is high frequency and, low frequency and high pressure, and it is recommended. So the frequency, we're saying, when you're talking about the frequency, we are going to put the frequency 6 for 5 minutes on pressure of 10, then 8, then 10, all right? And each session will be 5 minutes. Let me show you what I'm talking about. So this is normal. We are going to press normal. Then, okay, this is, or in the left spot, we can just set the pressure, okay? Let us use the low frequency protocol. We start by 6 hertz for 10 pressure, and we can just see each session, it has to be for 5 minutes. So when it's ready, we can just press on, okay? And we can just make the patient ready, and you can see the vest is inflated. The vibration will not start until we press the on again, all right? And this, and it has to be given to the patient. You know, sometimes the patient will feel some discomfort. The patient, he can just press it, and the vibration will stop. So I will just repeat the protocol. We can set 6 hertz, 8 hertz, 10 hertz, each session for 5 minutes with the pressure of 10, okay? This is when we say low frequency and high pressure, okay? The second protocol, which is like high hertz, we are talking about almost 16, 18, 20, like this is the hertz with 6 pressure, and each session, I'm talking about 16 hertz with 6 pressure for 5 minutes. And I'm talking about, we have to, it has to be the session between 15 to 20 minutes, same as the frequency, which I forgot to tell you. So the session, it has to be between 1 to 2 times, between 15 to 20 minutes in each or per session. So this is what I have. This is what I want to cover, which is basically 2 devices, which is the vest, okay, frequency. The good thing about the frequency, which is from my point of view, the vest cannot vibrate, or it cannot be used, or it's difficult to use it with the babies or neonates. But for the frequencer, we do have a small small adapter or small filter, which can facilitate using this frequencer or this vibrator with the neonate. So this is the end of my session. This is Abdul Wahab Al-Ahmari, and it was my pleasure to be with you today. And inshallah, by the end of our session, we will be happy to answer your question. Now I'll move to my colleague Soluchana Kumari, which is, and she's going to talk about the adjunct devices and its application and its indication.
Good evening, everyone. Today I'll be talking about the adjunct therapies in bronchial hygiene. These devices basically are used to mobilize the secretions in all patients who are suffering from chronic respiratory disease and they have a lot of secretions. So there are basically two types of devices, two classification. One type of device is called as PEP devices. PEP is positive expiratory pressure, and the other type of devices includes both PEP plus oscillatory vibrations. So the first device that I'll be talking about is TheraPEP. This device basically consists of different parts. This is the resistor. If you could closely see it. This is the resistor. The resistor consists of one-way valve here. If you can see this white structure, this is a one-way valve. This is the resistor dial where they have mentioned the resistance is mentioned here from 1 to 6. The resistor valve dial, if you see it closely from this end, with each device, with each number, when I turn it to 1, then you can see there is fixed orifice here. When I keep it on, place it on resistance 1, then patient will have the minimal orifice. Patient has to exhale through the minimal orifice so that it will generate very high pressure. It will create high resistance, and patient has to exhale through the high resistance. Then the resistor is connected with a manometer which has a pressure level. The patient can visually monitor how much pressure is being generated. So this is basically the pressure indicator. So I will connect the resistor along with the pressure manometer, and then the other part of the device is a interface. This interface can be a mouthpiece or it can be a face mask as well. So this mouthpiece can be connected here, and one of the most important feature of this device is what? During exhalation, patient can monitor his pressures between these two indicators. There are two indicators here. The lower indicator indicates pressure of 10 centimeters of water, whereas the other one is 20 centimeters of water. So for during entire exhalation, patient should maintain a sustained pressure between these two pressures. It should not go beyond 20 and it should not be less than 10 centimeters of water. Before giving any of these devices, patients should be instructed about the proper use and indication of these devices. They should know how exactly they have to breathe in, inhale. There should be proper inhalation technique. Then there should be breath hold followed by exhalation. So when I will instruct my patient, I'll ask him to breathe in, to take deep breath, but it should be till the vital capacity, but not to the total lung capacity. Followed by, there should be a breath hold for 2 to 3 seconds, and exhalation, during exhalation should be for 3 to 4 seconds. During exhalation, patient can monitor, patient can see, visualize the pressure that is being generated and is reaching to his peripheral airways. So can you just hold this device for me? Okay. You have to hold this device in your mouth, okay, and try to seal it with your lips so that there should not be any air leak. Now, can you just take a deep breath, but hold it for 2 to 3 seconds and exhale so that you can raise this bell here, exhale, not to that extent. In between this, you have to maintain it for 3 to 4 seconds. So I will count 1, 2, 3, 4, stop, exhale. Okay. Again, take inspiration, hold it 2 to 3 seconds, exhale. Okay, try to maintain the pressure between these two range. 2, 3, 4, exhale, exhale. Okay, so patient can do this, take 10 to 20 breaths through the entire cycle, and after 10 to 20 breaths, patient can do huff cough. So during huff cough, whatever the secretions have mobilized from the peripheral airways to the central airways, it can be thrown out. There is another advantage of this device. This device can also be used for nebulization purpose. So before initiating the PEP therapy, we can give nebulization to the patient, which will help to, this is a jet nebulizer, small volume jet nebulizer. We can connect this device, and same thing, we can actually remove this pressure manometer during aerosol delivery therapy. Yeah, just need the mouthpiece. Yes. So patient can take, this one is the adapter, okay. I'll use it. Patient can actually take inhalation, nebulization, aerosol therapy can be delivered to the patient prior to the PEP therapy. Then after nebulization is done, it can be reconnected back to the device, and patient can do secretion clearance therapy. So this entire cycle, therapy can be done for almost 15 to 20 minutes, followed by huff cough therapy. If patient finds any difficulty during this therapy, then this therapy should be stopped immediately, and they should consult the healthcare providers. Now we will move to next device. These other devices are all oscillatory devices, which generates both PEP plus the vibrations. Now out of that, the first device, this is called as flutter device, which consists of a protective case. It has a metallic ball like this and spherical cone. This is the mouthpiece. So this cone should be placed on top of that. We will place the metallic ball, and then I will cover it, put the cover. Now this device can be used for any patient, let's say from those who are unable to maintain, or those who have a little bit difficulty in those patients who are unable to maintain PEP therapy or who have coordination difficulty, so they can easily use these flutter devices. So now flutter device, it's very easy to use. Patient has to put this device in his mouth and tightly seal it with his lips. Same thing during inhalation, exhalation, inhalation, breath hold and exhalation protocol is same in all these adjunct therapy devices. So when patient will hold this device in his mouth, he has to make sure that there should not be any leak from his lips. This device, the oscillation, during exhalation, the metallic ball generally vibrates. So that vibration generates an oscillation which generally gets transmitted to the lower respiratory tract, and this will help to mobilize the secretions. Simultaneously, it also generates PEP, which will help to open up the airways and keep the airway open. It will prevent atelectasis. Now I'll demonstrate how to use the flutter device. First, I will place it in my mouth, and I will try to manage, I can manipulate the oscillation, the amount of oscillation which is being generated by device by placing it either in upward or downward direction. Now, one of the most important factor is what? During exhalation, we have to make sure that patient is pressing his cheek so that the vibration doesn't get lost in his cheek. So this will help to ultimately enhance the amount of oscillations which is being delivered to the lower respiratory tract. So this was about flutter devices. Flutter device, again, it can be used for 10 to 20 cycles, followed by huff cough technique. Second device is acapella device. Acapella device comes in, this is also based on flutter principle. This device, there are two models in acapella. One is blue one, green one. Blue one is generally used for pediatric patient or those patients who cannot generate flow more than 15 liters per minute. Whereas the green one can be used for those patients who can maintain, who had expiratory flow more than 15 liters per minute. Now the advantage of this device over the flutter is what? This device is not based on gravity principle. This doesn't have a metallic ball, so it can be easily used in any position. Now I would like to show you how does it vibrate, what are the different parts. This is the mouthpiece. And when I can open this device, I'll show you. This is the vibratory flap. So when patients exhale through this device, this flap generally vibrates to create oscillations. And this oscillation will ultimately get transmitted to patient's lower airway. After doing this cycle breaths for 10 to 20 breaths, patient should do huff cough technique. Now the next device that I'll be talking about is RC cornet. This is the RC cornet and this is RC cornet plus. This is also additional device, oscillatory PEP devices, which is made up of latex. This has a latex hose, which generally when patient exhale through this mouthpiece, this latex hose will vibrate. This vibration will generate a oscillatory flow which will be transmitted to the patient's airway. It's very easy to clean. We have a device to clean also. And this is RC cornet plus, which also consists of a mouthpiece. There is two mechanisms here. One here, this is the resistance which can be managed. This is essential for those patients who have breathlessness. So in order to reduce breathlessness, we can manipulate this part and to increase the amount of resistance, to increase the oscillations. Here you can see a mark here which will determine the resistance. So when we change it from lower to higher, the amount of resistance will increase and ultimately patient has to breathe against this high resistance. This can be also used for pediatric patient because they find it very handy and they like to use these kind of devices. This device has extra advantage that it can be connected with the nebulizer. Now the last device that I'll be talking about is aerobica. Aerobica is a device which is developed in US. This is also based on oscillatory PEP principle. This consists of 4 parts. This device has 4 parts: mouthpiece, then the upper body case. It has a canister. In this canister, there are rings which will generally, this flap will vibrate during exhalation, which will generate the oscillations. Now we can also manage, this black thing is an indicator which is generally used to indicate the amount of resistance which is being created for the patient. And this is the lower case which has an indicator marker here. This will mark the amount of resistance. Now when I will place this device, I can take it off. I can place the canister inside the lower body case, okay, followed by the upper body case, and at last I will place the mouthpiece here. So I can ask my patient to take a deep breath. Same principle, I'll take a deep breath, I will hold it for 2 to 3 seconds, and then I will exhale for 3 to 4 seconds. I can manage my resistance here. I can start with from low resistance, and gradually, if I find it very easy to exhale, then I will start increasing the resistance from the consecutive breaths. For this device also, you have to make sure that the vibrations should not get lost in the cheek. So we have to make sure that we are pressing the cheek during exhalation. I'll demonstrate how to use this device. I will take a deep breath. I'll hold it for 2 to 3 seconds. So this technique should be done for 10 to 20 breaths, and then patient can do huff cough technique to remove or to expel the secretions out. The advantage of this device is what? This device also can be used for nebulization purpose. We can connect it with a small volume nebulizer, or we can also connect it with the meta-neb. Okay, yeah. This is the nebulizer which can be connected. So this device is very easy to use for patients. It can be used by both adult and pediatric patients. It is very handy and it is very easy to clean this device. So this was all about the adjunct devices that we generally use for patients who suffer from bronchiectasis or cystic fibrosis. So that's it. Thank you so much.
Okay, so there are a few things that we did not cover, like the huff-cuff techniques and the autogenic drainage, but we just wanted to give you what is used generally out there and to allow for you to be exposed to, you know, what is used in the clinical setting. Now, I know people do ask quite a lot of questions as to what should be done. We obviously would give the treatment either before the nebulization, whether it be bronchodilators or antibiotic therapy or mucolytics, and then the patient would have their sessions done after the treatment. But there are other techniques that can be used as well. And under normal condition, we would actually, if you were here with us, you know, you would have the chance to put it on yourself and test it and see how it works. I think that the idea of bronchial hygiene therapy in cystic fibrosis patients, if you look at the literature, whether which device is superior to the other device is a very difficult issue that has been discussed a lot. But if you really skim through the literature, you'll find that it is, in the end, it's individualized care. Yani, some patients tolerate some devices more than other patients, and therefore what works for them might not work for the other patient. We have a Q&A session if you would like to throw in some questions here for the remainder of the time. Once again, we would have loved for the time to be a little bit more, but you know, we try to do our best. I'll hand it over to Prof. Adil for final comments if you want to talk about it.
Thank you so much, Dr. Khaled. It's very well presented, very well illustrated. It's very nice, hands-on, administrated workshops. We learned a lot. I'm sure attendees, they have learned from it, and probably they do have some questions. But anyway, I think the big question, as you have mentioned, what is the preference? Which one I do choose, especially in the younger age, in the absence of the availability? What is your usual recommendation?
My usual recommendation is for younger population, younger patients, I would go for, for this frequencer that's just hit the market right now. And, for teaching the parents to do, postal drainage for their children. As the patient becomes older and they can understand the instructions, then we would shift to, the adjunct devices that work very well. Even in, young children, the vest seems to be also working very well. So it depends on the category of the patient. For, the younger children, the infants or the newborns, definitely you would have to go with, autogenic drainage, allow the patients to put chest physiotherapy, I mean. Allow the secretions to drain on their own, tap on their chest, do some CPT. Once the patient becomes more, older and they have the ability to grasp the instructions, then you can move to adjunct devices and, more advanced devices. In an older population, then we would go for, the cuff assist device, the meta-nib, because these require quite extensive, cooperation, and they require also the understanding of the tolerance of the patient, which might be sometimes difficult in a younger population. That's how we would do it.
There is a question here from the audience. What is your approach for airway clearance after hemoptysis?
Well, after hemoptysis, if there is hemoptysis, we would not do any airway clearance, because that's a very emergency situation. And we don't, if the patient ends up vomiting or, coughing up blood, then we would have to stop the treatment definitely. And then we would have to refer them back to the physician for further investigation. Because this is considered an emergency, and we would never continue doing a treatment or advise a patient to have, bronchial hygiene regimen if they have hemoptysis that have to be, looked into before we can continue with the treatment of the patient.
True, I agree. It seems to be there are no more questions, but just I would like to remind all the audience that Dr. Khaled and his team also, they produced very nice videos last year, 2 years ago actually. It was being meant to be for the family in Arabic language, very nicely illustrated and administrated. So it's in the YouTube of the society. I refer you back to check them, and also to refer it to the parents, where it will help them a lot.
I want to bring my team behind me here just to say hi before we end for the night.
Thank you so much, all the team. And
Yes.
it's a reminder also, our main conference will be starting tomorrow, Friday, after Jum'ah prayer. So it will be 1:30 sharp. We're starting with our scientific program.
Inshallah.
Also, there will be a family awareness forum in Arabic for the families and for those who are interested from the community. It will be 8 p.m. in the same night tomorrow, Friday. There will be airway clearance in Arabic language for the family.
Yes.
And there is also hashtag for this conference. If you do have any question, any useful material you would like to share in the Twitter, so please just it's hashtag GCCF 2020. Thank you so much, Dr. Khaled and your team. Thank you. Appreciate it, and see you tomorrow, inshallah. Have a good night.
Thank you so much. Thank you for the opportunity to participate.
Thank you so much. And very, very thanks for our technical support and our organizer, Muhammad, Hamad, and all team behind the scenes.
Yes.
Thank you so much for your great work. Tomorrow, inshallah, we'll start. Have a good night, all.